disc herniation, surgery, exercises, and how it occurs. The lumbar region supports more than half of the body's weight. Combined with the high mobility of this area, it often leads to structural changes in the intervertebral discs. These discs are located between every two vertebrae of the spine and act as soft cushions that absorb weight. They consist of an outer tough layer, called the fibrous ring, and an inner soft layer, called the nucleus. Disc herniation most often occurs when bending forward. The vertebrae press the disc from the front, causing it to open at the back, leading to tension in the disc. This tension causes the soft nucleus to press against or even penetrate the tough outer layer. This process can lead to compression of nearby nerve roots or the spinal cord, causing pain and numbness. Muscle imbalance and disc herniation. Muscle imbalance plays a significant role in the development of disc herniation. The lumbar region bears the weight of the upper body, and if the body is not balanced, the pressure on the structures of the spine becomes uneven. This increases the risk of injuries and structural changes in the discs. That's why it's important to know which muscles need strengthening and which need stretching. However, this is individual for each person. If you want to understand which muscles are responsible for destabilizing the lower back and which ones you should focus on, I will upload a video dedicated to this topic. Subscribe to the channel so you don't miss it. Disc herniation treatment. The treatment of disc herniation depends on the stage of the condition. In the first and second stages, people can often recover without surgery. However, if you've reached the third stage, surgery becomes necessary to avoid permanent damage. The best way to determine what stage you're in is through an X-ray or MRI. Symptoms can also give clues about the stage of the disease. If you have pain and tingling, you are likely in the first or second stage. However, if you have a loss of sensation, muscle weakness, or difficulty controlling urination, it's very likely that you're in the third stage and will need surgery. Disc herniation surgery is usually performed through a minimally invasive procedure called a discectomy, where the surgeon removes the herniated portion of the disc that is pressing on nearby nerves to relieve pain and neurological symptoms. Relieving positions and exercises. When experiencing severe pain, attempting exercises may worsen your condition. Therefore, before starting exercises, I will show you some relieving positions. For the first position, you will need 2 pillows. Lie down on them, ensuring they are placed under the most protruding part of your lower back for proper support. In this position, the weight of the body will be distributed so that the upper and lower parts of the body pull in opposite directions, which helps to decompress the discs. Stay in this position for 1 to 2 minutes and breathe deeply. Another relieving technique is hanging, where your legs are pulled down by gravity while your hands stabilize the body. This exercise relieves tension in the lower back. This position is highly effective because it uses 60 to 70% of your body weight to create traction. By hanging off the edge of a table, bed, or sofa, gravity pulls your body downward while your pelvis stays securely stabilized on the surface. This natural pull helps to decompress the discs, providing relief and promoting better alignment. Common sleeping mistakes that create pain. Do you prefer sleeping on your side, but strong pain keeps you awake? This may happen because in that position, your pelvis rotates, causing tension to concentrate in the lower back. A simple way to correct this is by placing a pillow between your legs, which will help keep your pelvis in proper alignment. If you prefer sleeping on your back but still experience pain and tension in your lower back, try placing 1 or 2 pillows under your knees. Since the body has a natural curve, when you sleep on your back with straight legs, their weight increases the pressure on your lower back, which isn't ideal for disc herniation. Exercises for disc herniation. We've seen which movements cause the nucleus to slip out of the intervertebral disc, and now I'll show you exercises to help realign it and bring it back into place. Cobra exercise. The first exercise is called the cobra, and has 3 stages depending on the intensity of your pain. If the pain is very strong, start with the first stage, lying on your stomach with your hands on the ground. Gradually, after doing 3 sets of 1 minute each, with breaks in between, the pain should begin to subside. When you feel better, move on to the second stage, lifting onto your elbows, which creates slight tension and helps pull the hernia back into the disc space. Do 3 to 4 sets of 10 slow lifts, breathing deeply. If the pain doesn't worsen, proceed to the third stage, fully lifting the upper part of the body, creating an arch similar to a cobra. When performing the exercise, make sure your pelvis doesn't lift off the ground. The next exercise is performed while lying down, with your legs supported to form a roughly 90-degree angle. Position your knees so you can press down with the inner side of your heels, placing a pillow between your knees and another pillow under your neck. Press down with your heels and squeeze a ball between your knees. This activates the hamstrings and adductors. Hold the contraction for 2 seconds, then release. The most common mistake I see people make is lifting with their lower back. In this exercise, the lower back should remain relaxed. The tension should only be felt in the hamstrings and inner thighs. Strengthening the often weak hamstrings helps return the pelvis to its natural anatomical position, relieving pressure on the lower back. Perform 2 sets of 10 repetitions. To progress, lift your right leg slightly and press down only with your left heel while continuing to squeeze the ball between your knees. A red flag to watch out for is lower back pain. If you feel pain in the lower back during the exercise, it means you're compensating by using your back instead of the muscles we want to activate. If this happens, correct your form by rotating your pelvis better and squeezing the ball more firmly. Performing exercises correctly often makes the difference between improving and worsening your condition. Additional methods of relief. Besides exercises, there are passive methods such as kinesiotaping, which helps limit forward bending, the main movement to avoid with disc herniation. The tape also provides a soothing effect by lifting the skin during movement, reducing pressure on the underlying structures. Massage is also highly beneficial for relaxing tense muscles, which can help relieve pain and restore the body's natural balance. If you know someone with disc herniation, share this video with them. The information here could help them avoid serious problems and pain. If you enjoyed the video, click like and subscribe to the channel. Write in the comments about the pains you have and what other videos you would like to see. Have a nice day and see you soon.